So is osteoporosis when you have low calcitonin?
Osteoporosis usually goes with hyperparathyroidism because we're taking the calcium out of the bone. Bone resorption.
Stays in the blood.
Yeah.
Okay.
Yeah. So usually osteoporosis happens with hyperparathyroidism.
Okay.
We can look that up in the book and see what it says. Because it causes osteopenia, which is like the precursor to osteoporosis. What x-ray do we use to diagnose?
Oh, shoot.
Radio, no.
It's the DED.
DEXA scan.
DEXA scan.
Don't forget about that.
That scans your bones.
Yeah,
for
it looks at the
calcium.
density, and it's like the golden standard diagnosing tool for osteoporosis.
Okay.
DEXA scan.
DEXA scan.
Okay, so hyperparathyroidism means that your serum calcium is high because you have excessive bone resorption, osteoporosis, and renal calculi. You can get kidney stones because of it too.
Because all the calcium in your blood.
Yeah, exactly. But yeah, it does talk about osteoporosis because she had osteoporosis under hypoparathyroidism, and I wanted to correct that. It's really commonly linked with hyperparathyroidism because of the bone breakdown. But then just know that the DEXA scan is like the golden standard for that.
So if you have too little calcitonin, you'll end up with really dense bones.
Calcitonin. No, if you have little PTH.
Yeah.
Because calcitonin, I think if you had too much calcitonin, you would probably have dense bones. Because the calcitonin puts it back in, I think.
The way it does is
Osteoporosis.
PTCH or PTH is what brings it, like takes it apart. Calcitonin brings it back in.
Oh, yeah, that's osteoblast.
Yeah.
Sorry.
No, you're
I'm
good.
just reading this. It's all there. Okay. Osteoblasts build and osteoclasts break
Take
down.
down,
Yeah.
yeah.
Okay.
Okay, so incidence, prevalence, I don't care about that. I want to know about, okay. Building strong bones as a young person may be the best defense against osteoporosis. Teaching should begin with young women. You want to focus on getting them enough calcium daily. Explain the importance of exercise. Teach the need to limit the amount of carbonated beverages that they drink. Scheduled walking is preferred. That's like the best weight-bearing exercise to prevent osteoporosis, it says. Schedule regular walking. Teach people to avoid activities such as like horseback riding.
Really?
Yeah.
For
Didn't
osteoporosis?
know that.
Sorry,
I think
Tessa.
that's just
Oops.
stuff that's like likely to give you
Yeah.
like
Just cut down on the Mountain
microfractures and
Dew.
stuff like that.
Yeah.
Because that takes a lot of calcium to rebuild.
Okay, and then it says imaging assessment, DEXA scan. So it is the best tool currently available for a definitive diagnosis of osteoporosis. Guys, literally everything that's italicized in here is like super good.
Really?
Yeah. And then it says intervention. So we want to be careful with them. They're going to have to exercise and they're going to have drug therapy. So nutrition therapy, they need calcium with vitamin D because they can't absorb it without the vitamin D. The promotion of a single nutrient won't prevent, you have to have both. And then exercise is important. And it says, teach patients that walking for 30 minutes, 3 to 5 times a week, is the single most effective exercise for prevention of osteoporosis and the treatment. So 30 minutes of walking, 3 to 5 times a week. Teach them to avoid smoking.
And this is
Hyperparathyroidism, or just,
okay.
let's just say it's just osteoporosis. So once they have osteoporosis, this is what we're going to do. Intake of calcium should be between 500 to 600 milligrams a day.
Of calcium?
Mm-hmm.
Wait, how much was that?
500 to 600 milligrams a day. But we need to make sure we're giving them vitamin D with that too.